Have you ever had an itch that just wouldn't quit? What if that constant itch was actually your body trying to tell you something important? As we get older, our bodies change, and those little itches on places like your shins, neck, or back could be signs of something bigger. In this video, we're going to talk about 5 itchy spots on your body that you really shouldn't ignore. They could be early signs of health problems like poor circulation, kidney issues, diabetes, or even heart trouble. It's important to understand these signals because catching problems early can make a huge difference. Ignoring them could mean missing a chance to improve your health and even live longer. So stick around as we explore why these itchy spots matter, what they might mean, and how dealing with them early can help you live a healthy life. Understanding these signs can be the key to a better quality of life. If you are enjoying these health insights, consider how regularly viewing content like this can empower you to make informed decisions about your well-being. Let's start with itchy shins. A lot of older adults might just think it's dry skin, something that comes and goes. But that constant itch in your shins could be a sign of poor circulation. It's like your body's way of asking for help. The skin on your shins is often one of the first places to show signs of circulation problems because it's far from the heart. When blood flow slows down, your skin doesn't get enough oxygen and nutrients, which can lead to dryness and itching. As we age, our blood vessels lose elasticity, making circulation problems more common. One possible cause of itchy shins is peripheral artery disease, or PAD. This is when the arteries that supply blood to your limbs become narrowed or blocked. It's like trying to squeeze water through a clogged pipe. The blood can't reach the skin properly, causing dryness and itching. PAD isn't just uncomfortable, it's also a warning sign of heart disease or stroke. Untreated PAD can seriously affect your lifespan and quality of life. But the connection between itchy shins and poor circulation goes beyond just discomfort. It could be a sign that your heart or other organs aren't working as well as they should. Even if you don't have pain, it's important to get it checked out because untreated PAD can lead to ulcers, tissue damage, or even amputation in severe cases. Listen to your body and trust those little signals like the itch on your shins. They could be telling you something important. Take Miss S. Thompson, for example. She was a vibrant 72-year-old who noticed a persistent itch on her shins. She thought it was just dry skin, but it wouldn't go away. Her daughter convinced her to see a doctor, and she was diagnosed with PAD. Because they caught it early, she was able to make lifestyle changes, take medication, and focus on exercise to improve her circulation. Her health improved, and the itching went away. She learned the importance of paying attention to her body. If you're experiencing itchy shins, don't just ignore it. It could be a sign of poor circulation. Don't wait for things to get worse. Listen to your body, be proactive, and talk to your doctor. Catching problems early can make a big difference. Next, let's talk about itchy hands and fingers. Maybe you've been scratching them constantly and it just won't stop. It might seem like dry skin or an allergic reaction, but it could be more than that. It could be an early sign of kidney disease or diabetes. Your kidneys filter toxins from your blood, and when they're not working properly, those toxins can build up and cause itching, especially on your hands and fingers. This is often a deep, relentless itch that doesn't go away no matter how much you scratch. It's a symptom of a condition called uremic pruritus. Diabetes can also cause itchy hands and fingers. High blood sugar levels can lead to dry skin, making your hands more prone to itching. But diabetes can also cause nerve damage, called diabetic neuropathy, which can cause tingling, burning, and intense itching in your hands and feet. If you have other symptoms of diabetes, like frequent thirst, unexplained weight loss, or increased urination, it's important to get checked out. Uncontrolled diabetes can lead to serious complications. Take Mr. Johnson, for instance. At 78, he had an irritating itch on his hands and fingers for months. He thought it was just the dry winter air, but nothing seemed to help. The itching got worse, and his skin became dry and discolored. His daughter urged him to see a doctor, and he was shocked to learn that he had kidney disease. His kidneys weren't filtering waste properly, causing the itching. Thankfully, because they caught it in time, he was able to make lifestyle changes and begin treatment to slow the progression of his kidney disease. The itching finally subsided. If you are experiencing itchy hands and fingers, ask yourself if you have other symptoms, a family history of kidney disease or diabetes, or if your skin has become excessively dry. If you answered yes to any of these questions, it may be time to see a doctor. Early diagnosis and treatment can prevent serious complications. Now, let's move on to the neck and jawline. We often think about itchy skin on our arms, legs, or back, but the neck and jawline can also be prone to itching. The skin in this area is delicate and sensitive, and it's exposed to a lot of movement, environmental factors, and contact with fabrics and skincare products. Persistent itching in this area shouldn't be ignored. As we age, our skin becomes thinner, loses elasticity, and retains less moisture, making it more susceptible to dryness and irritation. If you find yourself constantly scratching at your neck and jawline, it could be a sign of a thyroid disorder, a chronic skin condition, or another health issue. One common cause of itching in this area is the thyroid gland, which regulates metabolism and hormone production. If the thyroid is underactive, it can lead to dry, itchy skin. Also, as we get older, our bodies produce less natural oil, leading to increased dryness and a greater likelihood of developing skin conditions like eczema or psoriasis. These conditions can cause chronic irritation, redness, and flaking around the neck and jawline. Consider Mrs. Davis, a 74-year-old woman who experienced relentless itching around her neck and jawline. She thought it was just a dry winter air, but it only got worse. She consulted her doctor and discovered that she had hypothyroidism, an underactive thyroid. Once she started thyroid medication and adjusted her skincare routine, she noticed a significant improvement. If you're dealing with persistent itching around your neck and jawline, don't ignore it. It could indicate a deeper issue. If you experience unexplained changes in skin texture, swelling, redness, fatigue, weight changes, or sensitivities to cold, consider speaking with a healthcare provider. Let's talk about an itchy back. That unreachable spot between the shoulder blades or a persistent irritation in the lower back can be really aggravating. But what if a persistently itchy back isn't just a nuisance? What if it's a sign of something more significant happening inside your body? While aging and dry skin are common culprits, sometimes an itch is more than skin deep. One of the most overlooked causes of persistent itching on the back is diabetes. Diabetes doesn't just affect blood sugar levels, it impacts the entire body, including the skin. When blood sugar levels are consistently high, dehydration becomes a serious issue. The body loses moisture, and as the skin dries out, it becomes increasingly sensitive and prone to irritation. This dryness can lead to a relentless itchy sensation that no amount of lotion seems to soothe. Diabetes can also damage the nervous system in a condition known as diabetic neuropathy. This nerve damage often manifests as tingling, burning, or itching sensations, particularly in areas like the back where nerve endings are concentrated. Recognizing the connection between high blood sugar and skin irritation could be the key to catching diabetes early before it leads to more severe complications. While diabetes is a common cause, it isn't the only internal issue that can lead to persistent itching on the back. Another serious condition to consider is liver disease. The liver plays a crucial role in filtering toxins from the bloodstream. When the liver isn't functioning properly, these toxins build up and can trigger widespread skin irritation and intense itching. This type of itching is often more pronounced at night and can feel deep-seated, almost as if it's coming from beneath the skin rather than just on the surface. The thought of liver disease or cancer as a potential cause of itching might sound extreme, but that's exactly why it's so important to pay attention to persistent symptoms. Ignoring them or brushing them off as just dry skin could mean missing a critical window for early diagnosis and treatment. Consider the case of Mr. Harris, a 78-year-old retiree who assumed his itchy back was nothing more than a mild irritation due to dry skin. It started around his lower back and shoulder blades, and at first, he thought applying lotion would solve the problem. But as time went on, the itching became more intense, and he noticed that his skin had started to change texture, becoming unusually rough and patchy. His daughter, noticing the changes and his constant scratching, urged him to see a doctor. After some initial hesitation, he agreed. A series of tests revealed that Mr. Harris had early-stage diabetes. His doctor explained that his high blood sugar levels were drying out his skin and contributing to nerve irritation, which was causing the relentless itching. Thankfully, because he caught it early, he was able to manage his condition with medication, dietary adjustments, and proper skin care. Within a few months, his itching had significantly improved. If you find yourself frequently scratching your back, take a moment to assess the situation. How often does the itching occur? Is it getting worse over time? Do you notice any other changes in your skin, such as dryness, discoloration, or unusual texture? Here are a few steps you can take. Moisturize regularly, monitor other symptoms, check your blood sugar levels, evaluate your liver health, and consult a doctor. Finally, let's discuss itchy feet and ankles. As we age, one of the most frustrating changes can be an increase in itching, particularly in the feet and ankles. What may begin as a minor irritation can quickly become a persistent and uncomfortable issue that refuses to go away. For older adults, this seemingly small problem can be more than just an annoyance. It may be a signal from the body that something more serious is going on. Initially, many people might dismiss itchy feet and ankles as just another unwelcome sign of growing older. Dry skin, occasional irritation, or mild swelling might seem like normal inconveniences, but when the itching becomes persistent and is accompanied by other symptoms such as swelling, tenderness, or discoloration, it's crucial to pay attention. Persistent itching in the lower extremities is not always a simple side effect of aging. While dry skin is a frequent cause, it can also indicate underlying health concerns that should not be ignored. Our feet and ankles are often the first areas to show signs of circulation problems, fluid retention, or even more serious conditions related to the heart or kidney. As we age, our circulatory system naturally weakens. This decline in efficiency can lead to fluid retention, commonly known as edema, which often manifests in the feet and ankles. Edema occurs where excess fluid accumulates in the tissues of the lower body, leading to puffiness, discomfort, and in many cases, relentless itching. If you've ever experienced the sensation of your skin feeling tight and stretched, you know how uncomfortable it can be. The excess fluid buildup can make the skin more sensitive and prone to irritation. But beyond the discomfort, this condition may be a sign of something more concerning such as poor circulation, heart disease, or kidney dysfunction. One of the most common circulatory issues affecting older adults is peripheral artery disease, or PAD, a condition in which the arteries that supply blood to the legs and feet become narrowed or hardened. When blood flow is restricted, the skin in the lower extremities becomes dry, less elastic, and more fragile. Over time, this leads to increased irritation and a higher likelihood of persistent itching. Poor circulation also reduces the body's ability to heal minor cuts, scrapes, or other skin irritations. This means that even a small scratch on the foot or ankle can turn into a significant problem if left unchecked. If you notice that your skin is taking longer than usual to heal or has become increasingly itchy and inflamed, it could be due to reduced oxygen and nutrients supplied to the affected area. We often associate edema with swelling, but many people don't realize that it also contributes to persistent itching. The more fluid that accumulates, the more stretched and irritated the skin becomes. This condition can be linked to serious health problems such as congestive heart failure, or CHF, which occurs when the heart is unable to pump blood effectively. When the heart struggles to circulate blood efficiently, fluid tends to pool in the lower extremities, causing swelling, tightness, and discomfort. For some individuals, the first noticeable symptom of heart failure may be persistent swelling and itching in the feet and ankles. Unfortunately, many people overlook these early warning signs, assuming they are just a normal part of aging, but ignoring these symptoms can be dangerous, as untreated heart failure can lead to life-threatening complications. To illustrate the importance of paying attention to persistent itching and swelling, let me share the story of Mrs. Williams, a 72-year-old woman who dealt with this very issue. For months she noticed that her feet and ankles were itchy and slightly swollen by the end of the day. At first she dismissed it as a minor irritation, blaming dry skin and perhaps a bit too much standing. However, as time went on, the itching became more intense, and the swelling refused to go away even after moisturizing regularly and keeping her feet elevated. Finally, Mrs. Williams decided to see her doctor. After undergoing a series of tests, she was shocked to learn that she had congestive heart failure. The fluid retention in her legs was not just an uncomfortable side effect of aging, it was a serious medical condition that required immediate treatment. Her doctor prescribed medication to help manage her heart condition and reduce fluid buildup. Within weeks, she noticed a significant improvement. The swelling decreased, the itching subsided, and most importantly, she gained a greater understanding of the importance of listening to her body. Had she waited longer to seek help, the consequences could have been much more severe. If you've been dealing with persistent itching, swelling, or discomfort in your lower extremities, don't ignore it. Here's what you should do. Don't dismiss it as a minor issue. Monitor your symptoms, check for other symptoms, stay active, moisturize regularly, elevate your feet, and consult a doctor. You now have a better understanding of the importance of paying attention to persistent itching on your shins, hands, neck, back, and feet. Remember, these seemingly small signs could be early warnings of serious health conditions. Your awareness can be a powerful tool in protecting your well-being, and regular engagement with health-focused content can further strengthen your understanding.